All right. Got a nice group today, especially for December, the last month of the year. It's nice to see so many of you. It's nice to see so many of you who are from states who we haven't seen before and countries we haven't seen before. So welcome, and we're really happy that you're here. Today, we're really going to talk about strategies to promote well-being and ensure quality care. You're going to hear from 5 really dynamic presenters who all have a different view on, how to really promote that well-being in you as a parent and a caregiver, and how to really build those quality care teams. So I think you're really going to enjoy today's session. All right, Laura, do you want to go to the next slide for us? Great. Like I always say, we have a large group. So if we call out a state that you're from or an area you're from, give us a wave. We always like to see who you are. One of the things that we really like is when you ask questions and offer suggestions and recommendations. But we always want to make that caution that if you do ask a question that's really, personal to you and your family, please do not share any health information, or what we call protected health information. That's anything that identifies you, your child's name, date of birth, anything like that. We want to keep that as protected as possible. We've found in the past that sometimes we get really excited and ask the first question, second, and third. And when we do that, sometimes you can really release that information without recognizing that. So again, just really be cautious of that. And, we're happy to follow up with you one-on-one if needed, if it's a really intense question. So feel free to reach out to us through the chat at any time. We're going to have poll questions too. And Laura, I think you jumped ahead, but that's okay. We'll get to the poll questions. We're going to have you fill those out. We always say your voice matters, so make sure you fill those out. It helps us to learn what you're learning, and then how we can do things better. All right, Laura, next one. All right, again, when you sign in, make sure you change the name in your Zoom square. You can put your first name, last name, whatever you'd like. If you want to put where you're from, that's great too. It's just always nice to see, that you're maybe Amy from Ohio, like I am. A couple of cautions: if you see a red line over your microphone or your camera, that means that we cannot hear you, cannot see you. And if that's off, we can hear you and can see you. So just be mindful of that. We don't want to share or hear anything that might be, again, that protected health information. And as always, use the chat at any time if you have a question. Feel free to reach out to anybody here on the support team, the resources team, or the hub team if you have things that you need. All right, next slide. You will have access to all the resources and slides from today's session, so stay tuned. We'll get through that. If you've been with us in the past, you've probably gotten an email a few days after the session that has all of the links to find all that information, so that we will continue that process. Next slide. Again, we always like to talk about Project Echo because it's just such a great platform for learning, and it's really about moving knowledge and not patience through case discussions and presentations like we're going to do today. The thing that's nice is you can access this from wherever you are in the world. You don't have to travel anywhere to learn this information. We're always going to do the same things. We're always going to do those welcomes, the overviews. Then we're going to get into case presentations and discussions where you get to ask clarifying questions as well as give us recommendations. And then we're going to go into those discussions and presentations from our presenters for today, which I think you're going to really enjoy. And our goal as always is we always hope that you're going to take what you learned today and be able to apply it back to your own life and pass it along to the providers and the other people that you live with in your community. Next slide. All right, so again, our agenda, we're going to always do that poll question to sort of measure learning. We're going to introduce the hub team, say hello to all of you, get to our presentation for today, and do lots of questions and discussion. As always, this is recorded, so just be mindful of that. We de-identify everything, so your information is never shared beyond the session today. All right. So Eric is not able to make it or to be with us today. He's got another pressing meeting he had to be at. So Lisa, I'm going to kick it to you.
Hello, everyone. Lisa Nowinski from the Mass General Hospital Lurie Center, just outside of Boston, Massachusetts. And I'll pass it over to Amanda.
Hi, everyone. I'm Amanda Bennett, developmental behavioral pediatrician at Children's Hospital of Philadelphia. I'm excited to be here. And I'll pass it to Sapna.
Hi, everyone. Sapna Shetty, couples and family therapist at Nationwide Children's Hospital. Welcome, everyone. I'll pass it on to Andrew.
Thanks, Sapna. I'm Andrew Nelson with the Autism Speaks Autism Response Team, and great to see you, everybody. And raise your hand if you're from West Virginia out there. Amy, over to you.
Hi, everyone. Amy Hess. I'm the family partner here at Nationwide Children's Hospital. And I don't think Josh has joined us yet. When he gets here, we'll introduce him. So Sabrina, I'm going to hand it over to you.
Hi, everyone. I am Sabrina Long. I'm a social worker here at the Child Development Center at Nationwide Children's Hospital, and I will pass it on to Cody.
Hi, everybody. My name is Cody Hostetler. I'm a psychologist here at Nationwide Children's Hospital. It's good to be with everybody. Ellen?
Hi, everyone. My name is Ellen Geib. I am a psychologist also at Nationwide Children's Hospital. I'm also a sibling and serve in that sibling partner role here. Passing it along to Amy.
Hi, everyone. I'm Amy Newmarm, I'm a developmental behavioral pediatrician here at Nationwide Children's Hospital.
All right. Hey, I'm Lindsay Bartram, also a developmental behavioral pediatrician here at Nationwide Children's Hospital, also from West Virginia. So very excited that somebody gave us a shout out for West Virginia earlier. And I don't know if Angie's here. Amy, is Angie with us today?
She is not here today.
Okay.
Yeah.
All right.
All right. So we can go to the next slide. Andrew, I'm going to go ahead and have you and your team introduce themselves.
Absolutely. So we're happy to be with you today. Again, my name is Andrew Nelson, and my colleague Annabelle Vasquez is with us today. We're going to be watching the chat. So if you have questions about local resources or tools or just questions about your region, we're here to help. And I do want to point out that Annabelle is also Spanish speaking as well. So if you have questions and you'd prefer to ask those in Spanish, please do. We're here to help. And we'll talk more about the Autism Response Team at the end of the presentation.
Hi, everyone. This is Melissa Miller here from the support team. I'm here with Nancy and Wura, and we're here and available if you need any help. Feel free to send us a message. Thanks.
Great. Welcome, everybody. All right, next slide. So I wanted to let you guys know that you now represent almost the entire United States. North Dakota is the only holdout state that has not joined us. So if you know anybody that you'd like to invite from North Dakota, let us know or send them our way and we'll get them invited. But we're great. It's great to see so many people participating from across our country here. Next slide. I think that another really exciting thing is to look at the number of participants that are outside of the United States. Australia joined us for this session as well as Japan. So again, it's great to see you. We're happy that you're here. If you have questions, please, chat them in, and if we can help you in any way, please let us know. But it's great to see all of you. Next slide. All right, Lisa, I'm going to send this over to you for the poll question.
All right, wonderful. Thanks so much, Amy. All of you should be seeing a poll pop up on your screen, and we would love for you to answer these 4 questions for us. We're going to come back to this poll at the end of today and hope that we've all had a chance to sort of learn and reflect on some of the things asked about, including self-care and planning for the holidays. So take a look at these questions. We'll wait to see if folks can get their answers logged in. If you only see the first 2 questions, you may have to scroll down a little bit. It looks like we've got our first participant. So we've got more than 120 people out there. So see if the rest of you want to chime in as well. So far, we have some good consensus on the first few questions, some mixed opinions on the third question. We really appreciate your responses. It's great to see those trickling in. Thanks for taking some time to answer those questions for us, getting us sort of setting the stage for our talks and conversations today. Looks like our third and fourth questions are the most mixed here. Everybody is in agreement on question number 1 so far, so that's looking great. We'll give everybody just a few more minutes. We've got about 60 responses and we'd love to have a few more. So if you haven't had a chance to answer those poll questions, go ahead and take a look.
Lisa, you're right. Question number 4 has really got lots of different answers. At the end of the session today, Lisa is going to reveal the correct responses.
There we go. So far, it's a secret. So you'll have to see if you can catch the answers in our presentation today. I appreciate the confidence you all have in us as psychologists for being able to do many different things. Wonderful. We've just got just over 70% of you who've responded. Those last 30%, if anybody else wants to log in their answers to the poll questions, we'd love your input here. And we'll be moving on in just a minute. Good point, Sabrina. The psychologist-psychiatrist distinction is a tricky one. So that last question is asking about our psychologists. So those people usually have a PhD or PsyD, not a medical degree. That gives anybody a hint. I've got some messages coming to me directly. I love it, guys. People who really want to know if they passed the test. We have some high achievers on our call today. We will definitely review all of that at the end, but your input on our poll is so helpful. And it looks like we're just around 80% here. So
All right, we ended the poll.
awesome.
All right, I think now we're going to move on to our case discussion. Sabrina, are you ready?
I am ready. Okay, so I am going to present on Sam, who is a 4-year-old white male, recently diagnosed with autism, history of developmental delays. Initial concern was for childhood apraxia of speech, but that was ruled out. Child is now speaking in full sentences. He has a twin brother who also was diagnosed with autism, but this twin is much more delayed than Sam is. So twin is nonverbal, no social interest. So parents didn't see how both children could have autism. Family has been told in the past that he couldn't have autism because he is too social. He's active in speech therapy, no medications. Next. Go to the next slide. So at feedback, Dad was not in agreement with the diagnosis or the recommendations. Mom was uncertain, but was willing to do whatever to help Sam. Family is also traveling to visit extended family members for the holidays. Family already knows about the twins diagnosis, but parents aren't sure if they want to tell everyone else about Sam's diagnosis yet. Grandparents have already said about the twin that they just worry too much and he'll be okay. They don't need to put so much stress on all of this. We can move to the next slide. So before we move forward, do people have questions about our case?
I have a question.
Sure.
What kind of intervention is the family doing for both children, being as though they both have diagnosis, but they're like on two opposite sides of the spectrum?
So they are both in speech therapy and both in preschool at this point. And that's all.
Okay, thanks.
Great question. Go ahead, Bree.
Either of them have IEPs in their preschool program?
Yes, both have IEPs for developmental delays.
Okay.
I see a question coming in here from Jean. What's the father's reluctance, or what did you run into, Sabrina?
I think these are their only 2 children, and so to hear that both of them have autism was maybe difficult to hear, especially with the discrepancy in their skills. So I think there may have been some hope that this child didn't have autism.
We have a couple other questions in the chat as well.
Follow the chat.
Yeah, I'll go ahead and ask some, Sabrina. So Steph asked a good question about whether they received any early intervention, and Beth asked a question about whether MChats have been done for the more social child.
That's a good question about the MChat. I don't know the answer to that. I do know that they both received early intervention. Like I said, there were concerns for apraxia for Sam. So they started doing speech therapy early on, probably around the age of 2, and have continued with that.
That's great. And we've got another good question about sensory differences.
Yeah, so that's probably another concern, is that Sam's twin is much more sensitive to sounds and to foods and has trouble kind of, with differences, changes, new things, new textures. So that's something they hadn't noticed with Sam. Sam is a little bit more rigid in his play though. And so even though he plays and is social, he wants to be in control of the play.
Looks like Pam asked a really nice question about whether or not either of the children have any medical diagnoses.
So no, they were full term twin pregnancy, so no complications that way. Really just developmental concerns.
And Sarah asked about that exactly. Can you tell us more about the kinds of developmental delays that they're showing?
Yes, so no motor delays, just really started with speech delays, and then some play deficits that they started to notice. Although parents don't necessarily see Sam as having difficulty with play because he does like to play with toys. He just does so in more of a scripted, rigid way.
I'm going to throw a question in there from me, Sabrina. Can you talk a little bit about what a family's relationship with their extended family, sort of what connection and contact they typically have? What does that relationship look like in typical times?
Yeah, so actually with this family, the maternal grandmother lives in the home with them and helps care for the kids. Paternal grandparents live out of state, so they don't get to see them that often, especially with COVID. So this is a big kind of get together that they're having. And I think a lot of what paternal grandparents see is just what they see over video calls. And so they don't have the same kind of depth of understanding of what's happening every day.
That's great. Thank you. It looks like we've got a couple other questions about sensory problems and whether or not the kids have had any sign of regression.
So no regression. Sensory problems, I think I was saying that the twin brother had some sensory issues with feeding and with sounds, but Sam doesn't really have any other sound or sensory issues. There's so many comments, but I can't see them.
Yeah, Sabrina, Sapna had a great question of, when you think about this family, is there anything that comes to mind with cultural considerations for the entire family system?
Yes, so actually it's a great question. Family, mom is originally from Argentina. And so there is a little bit of that, and grandma of course is too. So there is some Spanish in the home, but they're not exposed to much because dad doesn't speak Spanish. So dad is from the US, so no cultural things for him. But oh, I saw somebody say sleeping problems. Sleep is good, no sleep issues. They sleep in separate rooms, so they're not interrupting each other during sleep. Both take naps pretty easily still. If they're not in school on the weekends, they'll nap.
So Crystal shared, going back to the diagnosis, what was it that led to those concerns for autism when you think about, okay, other than speech, what does that actually look like to be too social, and what are the pieces that are still big barriers for Sam?
So from what I remember, Sam's preschool teacher was the one who expressed concern, like, oh, maybe he might also have autism. We should think about having him evaluated, because what the teacher was noticing was transition difficulties, like I had said, the rigid play, so not wanting things to deviate from the way he thinks about it. So you say it like this, and then you move this guy here and put him there, and then I'll say this. But anytime the teacher would try to say, oh, but I want to do this with this guy, he'd be like, no, and have a big meltdown. I think so that's what led to that concern from the teacher. But parents were thinking, well, he is verbal and his brother is not, and he will say hi to you and he will give you a hug if he sees you. He smiles at you. So they just thought that it couldn't be the same thing. And I think they were also surprised when, you know, he got was put on a higher level than they would have anticipated. So, you know, I think his diagnosis was a level 2, and they were thinking like, well, if it is, it's probably less than that.
Hey, Sabrina, there's a good question here too about anxiety symptoms or difficulty with change in routine.
Yeah, I think it's just that was the concern, is that anytime anything would change, there would be a big meltdown, especially in the classroom environment. So I don't think it was as big of a concern at school, but parents are pretty flexible in their routines, so they often kind of defer to what the kids need. Any other questions? Any recommendations?
I'm wondering if the dad is getting a lot of feedback from his own parents who are trying to minimize Sam's signs and symptoms, and just maybe some education for the father to share with his parents. Things are a lot different from when they were raising their kids in terms of autism. Maybe they just recognize autism in the more severe brother, but don't recognize the signs that we nowadays do recognize as autism.
Thank you. I think that is one of their concerns about sharing with the extended family members, because they're not sure if how the rest of the family will take it. And they're still coping, they still haven't decided how they feel about it. So I don't know that they're ready yet.
What's happening with their interaction with their primary care physician? Because if, they're obviously having problems with speech, not meeting the milestones, but they've met all the other milestones, I guess. So there's nothing that the primary care has said that about his concern for autism with the one twin.
Yeah, that's a really good question. I think that everyone's focus was so much on the twin brother initially that, they kind of comparatively, even though the pediatrician was maybe a little concerned, they're like, well, he's doing much better than his brother. So they put a lot of their emphasis in on the twin.
Yeah. I have twin grandchildren that have autism, and it's interesting, when they were young, and it was picked up by, I think, in the medical profession, it was not by the parents necessarily, but it's interesting as they've aged, they're 11 now, how one is much more affected by autism than the other one. And one of them is having a lot of behavioral problems in the school, and the other one isn't, which always is, to me, an enigma, since they were identical twins.
Yeah, I think that's exactly part of how the parents are struggling with all of this, the differences.
Sabrina, there's been a couple of nice comments in the chat about focusing on, connecting the families with the supports that the child needs, and sort of letting the diagnostic conversation sit for a little bit, not necessarily focusing or harping on that piece so much. And also a couple of comments about potentially some support, some sort of emotional support for parents, particularly mom, but potentially mom and dad, right? Or grandparents, to be involved in offering some support for them.
Lisa, it's really interesting. We actually, in one of our earlier meetings, had a talk about family therapy, for families that are just dealing with a child with autism, and that is helpful to think about. Great. Well, thank you all so much for your thoughts and questions and helping me figure some of this out.
Great, thank you, Sabrina. All right, so we're going to get into the main presentation today. We have, like I said, we have 5 presenters who are going to be part of this. So I know you've met them in the beginning, but I'm going to have them just say a few extra lines about what they do here in work in autism, and so you can get a little more information about them. So Sapna, do you want to start us off, and then we'll just go straight down the line?
Sure, yes. My name is Sapna Shetty. I work at the Child Development Center of Nationwide Children's Hospital, and I've been here for about 15 years. I do a lot of diagnostic assessments, and then sort of the post assessment piece where I provide family therapy in terms of helping the family system cope with the diagnosis, whether it be the couple relationship or shared parenting, or siblings that might be impacted as well. So I do a little bit of assessments as well as treatment. And then I'll pass it on to Sabrina.
Well, hello, everyone. I'm Sabrina Long. As I said before, a social worker at Children's Hospital. I was looking at Cody's message. I should close my chat is what I should do. I have been at Children's Hospital for 18 years. The past 10 have been at the Autism Child Development Center. Prior to that, I was in the early intervention program as a social worker. My job is very
Sabrina, I think we lost your feed there. We'll come back to Sabrina. Josh is not here yet. He is still on his way from work. So do we want to go ahead to Andrew or Cody?
Sure, I can go. So nice to meet you, everybody, again. Andrew Nelson with the Autism Response Team at Autism Speaks. We are an information and referral line for the autism community where you can call in, you can email with us, you can find us in live chat. You can also interact with us on social media or at a webinar like this. And what we do is provide resources, information, tools, and local supports to people who have any question about those therapies or groups that might be in their area, really any question under the sun. So at the end, again, I'll tell you how to reach out to us, how to contact our team, but we're a group of about 10 people around the country ready to help out. So over to you, Cody.
Thanks, Andrew. So yeah, my name's Cody Hostetler. I'm a psychologist here at Nationwide Children's Hospital, and I actually work in primary care. So what I do is I support the primary care providers and families. So, you know, that day that you went to your pediatrician and said, I'm really worried about my kid's development, or I have some questions about their behavior, rather than placing a referral, they bring me and our team into the room and we get to answer your questions. We do some brief autism assessments in primary care to kind of expedite things in partnership with our autism center. So that's what I do here at Nationwide Children's Hospital, located in primary care, and kind of provide that on the spot care and support and training to our medical colleagues.
Great, thank you, everyone. Okay, Warren, you want to go to the next slide for me? All right, so if you've been with us before, you've seen this slide, but we always like to talk about it. You know, one of the premises for Family Echo Autism is really we strive to bring that medical and behavioral information that we know, that we learn here in our clinics and in our work with families. And we know that it's helpful for raising children with autism. And we're trying to make sure we can give that to you so that you can apply it back into your own lives and then share it with your providers and share it with your community. You know, we really recognize that families are the other discipline at the table, and that, you know, as a family member myself, I know that I need education and training and empowerment to really do the best job I can, you know, in raising my son with autism. Next slide. The other thing that we always like to say too is that, like I said, families are, you know, are partners in the care team. So the information you bring into those care appointments is really valuable, and your voice in the healthcare and treatment processes for your child are incredibly valuable. You have so much information to share that we want to make sure that you really understand how much you should bring and what you should bring to those appointments and things. So we encourage you, again, to take back what you've learned today, take it back to your family, to your community, to your providers, and, you know, share as much information as you learn in the session, and then also to share with us so that we can continue to provide information that's helpful for you. Next slide. One of the things we wanted to talk today about is that, you know, building strong care teams are really a goal for families. I know for my own family, it's a huge goal we've always, you know, strived to achieve. So I wanted to show you on the slide, you know, and if you're a family member, if you're a caregiver, you sort of already know this, but what life is like raising a child with autism. You know, there's multiple disciplines working to impact education, health, and the life trajectories of a child with autism. So when you look at this circle in the very middle of it, you're going to see my son Henry. And I always say that I'm sort of the primary case manager for Team Henry, right? And I mean, I'm gonna give you just a little snapshot of what his life was like around the age of 14. He's a little bit older now, but this is a snapshot back. But when I looked at all the different team members and all the different disciplines I interacted with, at one point we had 42 people that were a part of his care team. I'll say that again. We had 42 people that I had to interact with at one point because of, you know, because he was diagnosed with autism and he needed a lot of services. You know, and this included his primary care providers, psychology and behavior management teams, his teachers, his one-on-one aides at school. We had a specialist for sleep and nutrition because he had really big issues in that area. We also had, you know, what I call service staff. So we have county boards here in the state of Ohio. And those are the people that help us to fund like speech and OT, things like that. We also had a transition specialist because at 14, you're supposed to start thinking about that. We also had community team members who helped them to, you know, really get access to life opportunities like, you know, dance class and learning to ride a bike and those kinds of things. But it also included dentists and dental hygienists that we had to work with so that he could get really good dental exams, you know, and then it moved into getting braces on him and we had to work with that team. We also had to interact with a lot of social workers and counselors who really helped to keep us grounded and focused. You know, and helped us to understand how we could pave a pathway for lifelong goals for Henry. So I wanted to share this because I think it's really important that the presenters today are going to talk about how do you balance all of this and how do you really build those care teams and what kind of supports are out there for you. So as we go through today, I think we can reflect back, and you all have care teams that are probably similar to this, but they're going to help us sort of walk through that path. So Sapna is going to start us off with how to balance it all. Next slide.
Thank you, Amy. So yeah, let's start with that question. How do we balance it all? Some of us are working from home while others of us have transitioned back to work sites while at the same time attempting to maintain household tasks, ensuring that children are keeping up with day-to-day responsibilities and activities, whether it's homework schedules or chores at home. And then there can also be financial stressors, right? With us being in the midst of a pandemic, loss of jobs or reduced hours, and then through all of this, new schedules can create stressors within family relationships as well. We can move on to the next slide. So practical strategies can include building a routine to your day with the support possibly of a visual calendar. And the key is to find a spot for that calendar that's seen by everyone, such as maybe the kitchen, placing a visual calendar on the fridge. It's something that everybody in the household does use. And then the visual calendar can also be a place where we're identifying roles for each family members rather than assuming that everybody knows what they should be doing. And then also exploring and accessing supports outside of your immediate support system. This can include school staff and therapists. They may have ideas or strategies that they've been implementing with your child that can then be generalized into the home environment and vice versa, where you can be sharing with the school strategies that you might be doing with your child at home as well. Yes, and then also reaching out to extended family for support, whether it be grandparents, uncles, aunts, and sometimes even close family friends. Older siblings within the family system can also help with younger siblings. And then sometimes I think we forget to slow down. When life gets hectic, when we continue to push and expect the same amount from ourselves, as well as the same amount from our children. When things get heavy and overwhelming, it's okay and really important to give yourself permission to reduce expectations, not just from within yourself, but from other family members as well, such as your partner and your children as well. And then most importantly, practicing gratitude. I think sometimes when there's a lot of things that feel hard, we forget about all the amazing things that are present within our lives. Reminding ourselves that what we do have and what is going well can help create a sense of balance as well. I'm going to pass it to Sabrina.
Hi, everyone. Sorry about earlier. I got kicked off. My internet went out. Related to this, I think you'll see a really common theme in all of these slides today, but wanted to talk about healthy thinking. So how you think can play a significant part in how you feel and how resilient you are when faced with obstacles. So flexible thinking practices really help you adopt a more balanced and realistic thinking pattern. So you may not be able to change a highly stressful event, but you can change how you interpret and respond to it. And I just want to point out the picture because I think it's such a good representation of how our burdens are all our thoughts in our head and how heavy that can be for us. So similar to what Sapna had said, we want to focus on the good things, no matter how small or big they are. This doesn't mean that you ignore the bad and unpleasant experiences, but rather create an intentional opportunity to search for positivity while accepting that negativity. As Sapna said, practicing gratitude, there are gratitude apps that you can find. Laugh, we actually did oh gosh, was it last year, a laughter yoga kind of presentation as part of one of our family echoes. And that was really fun way to just bring something else into the mix. And then practice positive self-talk. So research shows that even a small shift in the way you talk about yourself can influence your ability to regulate your feelings, thoughts, and behaviors under stress.
Self-care for parents. This is so important and it sounds so simple, but I think it's so easily forgotten through the midst of everything else that you're busy with. So taking care of yourself allows you to be the best that you can be. When you take care of yourself, that gives you the strength and ability to take care of your loved ones as well. And it's also really important to remind yourself that this is also really good role modeling for your children and rest of the family members as well. So, moving through here, as we continue to talk about self-care for parents, we would love to hear from all of you, ideas of what you do for self-care. So please feel free to share via the chat feature, just different strategies or activities that you might be implementing within your life for your own self-care. And then as we're sharing, I'll also share some ideas here as well. Trying something new can be exciting. Is there an activity that you've always wanted to try but haven't made the time for? Whether it be painting, bike riding, writing poetry, giving yourself that time, even if it's not a lot of time, just finding ways to incorporate that into your day or your week can be gratifying as well. And then meditation and exercise can be an amazing way to release stress as well as negative energy. And then letting yourself get distracted, right? So taking breaks to go for a walk, getting some fresh air, or even listening to music. This past couple of years, just in the midst of a pandemic, I think a lot of us have been in front of our screens a lot through the day. So, reminding yourself that's okay to take a step back, walk around, get some fresh air. I think all those little things do make a positive difference. And they can also be helpful to limit your exposure and take breaks from news and social media as well.
And so there are different types of recovery and self-care. There is the physical self-care, which there could be a passive, you're sleeping, active, you're doing yoga or stretching. There's mental self-care, so taking a break, giving yourself small breaks throughout the day. Sensory self-care, intentional moments of sensory deprivation, creativity, emotional, so that's a good one, setting boundaries and saying no instead of reluctantly saying yes to something. Social, surrounding ourselves with supportive and positive people, and spiritual, so having some type of spiritual sense of belonging, so whether that's through prayer, meditation, or other involvement. And then along with this, I just wanted to give you some kind of suggestions on rejuvenation. So things that you can do. We talk about self-care, so things that you can do to kind of take that time for yourself and rejuvenate and get yourself some more energy. My favorite is saying no to things, creating a list of things that are fun and exciting, and committing to doing them, making time for your own meals instead of, eating while you're working at your desk. Actually making sure to take the time out and do something that's more relaxing for yourself. You can go to the next slide. There's just some additional recommendations or ideas for rejuvenation. Making sure that you're staying hydrated and drinking water, scheduling self-care time for yourself and sticking to that schedule. or even days that you just say, I'm not doing anything today. And, keeping to that schedule too, as much as you can. Turning your computer off at a certain time, turning your phone off. This way you can check out. You don't have to worry about anything else. And making sure that self-care is non-negotiable for you. That's okay, you're fine, you can move on.
So relationships, and I think this came up a little bit with the case presentation that Sabrina shared with us too. So our own individual well-being also depends on the well-being of others in a lot of different ways. With stressors, there might be increase of conflict within relationships between couples, co-parents, and also within the parent-child relationship. And the funny thing about relationships is that when we feel unsettled, uncertain, anxious, irritable, or depressed, we're likely to take that out to the people that are closest to us, the people that we love the most, whether it be our partners, our friends, or our children. Again, as we think about the pandemic, as we're in the midst of the pandemic, the loss of community relationships is so profound and significant. As we're in the midst of this, we've had to pull away from our natural supports outside of our family, such as friends, extended family activities, and self-care opportunities, such as earlier in the pandemic, even just something as simple as being able to use the gym, right? So this has made it all the more hard to stay positive. And then sometimes some of this agitation or frustration can come out within your family system. Couple boundaries are impacted, the risk of feeling lonely and suffocated at the same time. And then how well kids adapt, and factors that influence emotional impact on children are how caregivers respond and relationship and communication amongst family members. So when looking at the relationship within the family system, the quality of each relationship within the family can create either a strong or a struggling family unit. Accessing supports to work on challenging dynamics can benefit the entire family system. So I often tell the families that I work with, I can provide family therapy, even if you just have one parent present within the session. There may be a child or an adult presenting with the challenging or difficult behavior. If you were to look at it systemically, we would be perceiving that person as carrying the symptom for the entire family system. So I typically tell my families that it really isn't about just fixing one problem or the problem, but it's about how do we heal the family system and how do we help the entire family move through a challenging time. So what is family therapy? So as a couples and family therapist, that's a lot of what I do at the clinic. It's a form of therapy that provides supports for the entire family system. It can be especially helpful when a family as a whole or an individual within the family is going through a trying or challenging time. So what can family therapy look like? Family therapy can look many different ways depending on what fits the family's needs. A lot of times I'm typically working with the caregivers within the family unit. Sometimes that's just one parent, and other times there are maybe two or more caregivers present. So the entire family does not need to be in the session. Even just having one member of the family making changes and interactions can create positive changes within the entire family system. Families can come in for sessions once a week, every other week, once a month, and sometimes even just every couple of months, just depending on what works for the family. And then, within a medical clinical setting, doing family therapy in parallel to the supports that your child might be receiving, whether it be behavioral or developmental therapies, can be a great way to use this service. Family therapy can help couples, blended families, children, or members of an extended family learn to communicate better to work through conflict. It can also be used as a preventative measure. So if a family is moving through separation or an upcoming challenging time or transition, it may be helpful to connect with this support to prevent family members from going through crisis or conflict, and also to work on preventative strategies. Family therapy can provide a new skill to get through difficult situations in healthier ways, and also working on communication skills. And then the service can typically average around 12 sessions. However, frequency and duration typically depends on the family's needs.
All right, Josh Edwards is going to be joining us. He is our self-advocate. He's on our hub team. This is actually his first session where he's going to present. Josh, are you there? We weren't sure if your microphone was working. All right, Josh, I think we're having a little technical difficulty with your microphone, so we'll come back to your slide. I'm going to go ahead and we'll move on to Cody.
Hey, all. Thanks, Amy. So what I want to talk to you guys a little bit about is just team-based care, how to really develop a team and how to use the language. As we mentioned at the beginning, we really see families as key core team members. Amy said she is, champion of her team or her son's team and care coordinator and the one who makes all the magic happen oftentimes. But the thing is a lot of providers are asking you to do that. And although we are getting all kinds of training in how to do that, families often aren't getting that training on how to do that. They're just expected to do that. And so what I wanted to share with you guys is a little bit of the curriculum that medical providers and psychologists and social workers and OT folks get on how to develop a good team care and what are the things that are important in order to develop a good team. And the reason I'm sharing that with you is two things. One, this is kind of the core principles that it takes to do good team-based care. And two, if you're working with a provider, you can use this language with them to really get them to highlight and convince them of the importance of team-based care. So the figure you're looking at is from the team-based care education consortium or collaborative. And so what that is it really comes from this whole training curriculum about how to train providers on how to work as a team. And we're going to break that down section by section over the next couple slides. So the first thing is just to build the team and then identify what is the role of each team member and what is each team member's responsibility. One of the ways that we often coach families to do this when we're coaching them through the process is to just create a table, whether that's on paper or in Excel. Those who know me know that I have this giant love affair for Excel and Excel tables and color coding. And so I do everything in Excel, and it could just look, you could have a tab for every area in their life. Here's our medical team, here's our educational team. It could just be one big Excel file, or it could just be on a paper that we hang up on the refrigerator. And you can include things on it like, what is the role of each team member? So we have our teacher, and what is their responsibility, and how do I contact them, and when do I contact them, and when do they like to be contacted? And you can have all of this kind of identified within a quick chart, so that way when you're feeling stuck or when somebody asks you who I need to collaborate with, you just kind of pull out your chart or your Rolodex of all the team members and say, I have this problem, who's on my team that can help me solve this, or who is not on the team that I need to add to the team, so when these kind of problems come up, I know who to turn to. So it's important to work with providers who really value input from other people. So what we train is, to be a good team member, you need to value the input and the expertise of everybody on the team, not just you. And so as a family member, obviously like trusting the input or listening to the input from folks on your team, but also having them listen and trust the input that you provide as well, and wanting to share information across team members and maintaining mutual respect and that shared value that everything is easier and better and improved outcomes when we work together as a team, and understanding their scope of practice. So understanding what their role is on the team, what their responsibilities are in the team, and this is kind of my job on the team, and not overstepping into what other team members are supposed to be doing. Of course, it's helpful to share information. Hey, I wonder if this would be helpful, versus trying to tell other team members what to do or how to do their job. The third big component for developing a high quality team to support your child is communicating in a responsive and responsible manner that really supports the team approach. Asking questions that just assume that team-based care is the way to go, right? So how do you like to communicate? How do you like to communicate with this person? Who's going to communicate that information? What information what do you need from me to best communicate with this person on the team, or to do your job best? What information are you going to need from me, and how do you want that information? What information do you need from me to be able to talk to the school? Is there a paper I need to sign? Because I'm happy to do that. I think it's really important that we're on the same page. Those kind of questions can be really helpful to spur the process, especially when providers feel stuck or don't have a lot of experience with this. And then building relationships both with each team member, but then also those connections in between team members is going to be really important. Asking your provider questions when you feel like you're not coming to a successful solution of who else could we ask this question? Who else can we put on our team in order to help us solve these problems? Who might benefit from this information? So one of the things that we do when we give feedback after a psychological evaluation is we say, here are the people I think that would be really helpful to share this information with. I'm wondering who else you think I should share this information with on your team to make sure that we're all coming from the same place and we all have the same information. And then finally, speaking more specifically to the role that psychologists play on the team, psychologists often offer a really diverse range of roles. So we might be doing assessment about whether autism is present or not present, or whether comorbidities, like we've talked about in the last couple sessions, meaning other conditions that might be present in addition to autism, like having anxiety with your autism, having ADHD that also presents with autism. Working on the thoughts and the feelings and the behaviors of kids and families, teaching social skills and developing peer relationships and play skills, learning how to best promote a learning environment or teach them specific skills or educational components, talking to teachers and doctors and coordinating and providing consultation, including even dentists. So I worked on a few projects where we worked together because psychologists are experts in facing fears and tolerating difficult emotions, and dentists need to get your kids' teeth cleaned. And so we partnered with them together to talk about how can we do this in the least stressful way possible. Amy has worked with me on my primary care team and our nurses to talk about how we can make well care visits when you go to the pediatrician. How can we make those visits less stressful for kids with autism? So you can actually have your team members partner with other team members to figure out how do we get our kids to the dentist and get them through and get their teeth clean, or go to the well visit and get their vitals done or get their shots done for their immunizations. And then also, like I said, preparing for and tolerating those medical procedures. All right, and it's time for our poll. Hopefully you guys have learned a few things and feel even more confident when you answer the questions on the poll this time.
Thanks, Cody.
Yeah,
That was excellent.
Oh, sorry, Lisa, go ahead. I was just going to say, if you have questions, go ahead and chat them in, or we have time to do some questions and answers right now.
Steph R. in Chicago asked a nice question about how parents can help shift the conversation to more of a strengths-based conversation versus coming from a deficit model. Any of our presenters today have thoughts on that?
I can speak to that briefly. I love when a parent comes in and says, there are some things that we want to work on, but first it's really important to me that you understand what my kid's good at. And it just sets the tone right off the bat. I love, love, love when parents start the conversation off that way. Interrupting, I think a nice interruption of like, it's so helpful to me that you're helping me solve all these problems, but I also want to remember some of the things, and I'd like to also not just address deficits, but build on some of my kids' strengths. And here's what I think my kids' strengths are. And I think if we leverage some of those strengths, some of these problems might not be as big over time. And so that's some of the ways that, for me personally, when I get stuck in problem solving mode, right? Most of us are helpers. We want to help you with your problems. And so we're quick to identify problems, and we're quick to want to like resolve those problems and fix those problems. And it can be so powerful and helpful when a parent stops me and says, it's really important that you also understand my kid's really good at some things. And I don't feel like we're spending enough time talking about that.
Those are some great suggestions, Cody. I also really love it when families can come into me with 2 or 3 thoughts about the things that are going well for their child. That often helps me find a place to start talking about strengths and figuring out sort of where we can build on. And you may come in with a couple of things that are going well and a few things that you need some help with, but that balance, I think, helps to balance out the conversation in a nice way.
I noticed the social stories. I love that to prepare for medical procedures. I used to work in a sleep clinic, and we developed a social story about getting a sleep study done, for example. And there's videos out there that have been developed, and there's books out there about getting different kind of medical procedures. And so I think I just wanted to call that out. I love that idea.
That's great. And we may give a plug. Our resource team can certainly help to share the information, but we have some really wonderful toolkits, including things like a dental toolkit that could be really helpful things to share with your child's dentist or to use yourself to help prepare for some of those tough visits.
Yeah, it's helpful for the dental provider too.
Yeah, I think if I'm remembering correctly, we have actually there's one toolkit specific for the dental providers actually. So those things are all really easy to access online, and our resource team can help connect you if you are having trouble finding them. Great question from Leah about certified therapeutic recreational therapists. I think I've seen a couple of comments that have talked about other specialists. And so I think I just would comment that each child is going to have an individualized team, and there may be certain specialists that are really important to include on particular teams that are unique to your child. I think, Bree, it looks like you've got your hand up. Do you want to go ahead and unmute and ask your question?
I was actually going to piggyback on what Leah was saying. I would love to see like recreational therapists or child life be involved in appointments for kids, particularly kids that are on the spectrum, across different practices. Because, for example, a child that needs to see the ophthalmologist might be, overstimulated by all of the pieces of that, and having that kind of support there in a practice that may or may not be as familiar with autism would be a huge, kind of way to bridge that gap. So I'd never thought of therapeutic rec, but that would be great as well.
That's great. Thank you so much, Bree, for that that reminder. That's really helpful. And did I see, Bernadette, did you also have your hand up? Did you want to unmute and ask a question?
I did. Somebody asked this in the chat, and I have the same issue. My daughter, she's 2. She is a huge risk taker. She has no fear. She will run straight into the street, no matter, jump off things. What do we do for that? Like, I've talked with OT and we've done the social stories. Do you guys have any suggestions?
That's a really good question. And I'd actually love to hear from some of our other hub team members. I think how we address this may be different in different clinics and situations. I know at our center, our physical therapists and occupational therapists are really helpful in doing equipment evaluations and safety evaluations. And so they can often be very instrumental in meeting with families and getting to know a child and thinking about whether there are any physical tools that could help make your job of keeping your child safe easier in sort of a healthy and constructive fashion. But I'd love to throw this out to the team and see if any of the other hub team members have thoughts on really risk-taking kiddos and how to keep them safe.
So I would add in Pennsylvania, families have access to community-based behavioral health services. So the ABA therapists are working with the family in the home or in the community. And so I've had a lot of my patients meet their ABA therapist at the parking lot to work on safety goals. And so if you have anybody on your team that's willing to meet you in the community and practice safety skills, that's a real life situation that the child can then generalize. Hopefully it's a lot easier to do in a real parking lot rather than in an office.
I was going to say the same thing. I think practicing in that real life environment is super important. And these kind of things don't work for everything, for everyone. But, psychologists, we always say we don't like to stop a behavior. We like to replace it, because it's really hard to stop a behavior unless we give them something else to do. And just some simple things that we might even do in the clinic is we might have them when we're walking through a parking lot or something like that, focus on doing it in a certain way that doesn't also allow them to run out into the street. And so if we are marching or picking our feet up tall, or if we are walking like a ballerina, or some kind of way of walking that is more controlled and funny for the kid, or playing some kind of game that distracts them in the sense of keeping their focus on walking slowly next to you, that can also be something that can be like a quick helpful tool when you're out in public.
Love that, Cody. That's really fantastic. It looks like we've got a couple last questions popping up here, and we have just 1 or 2 minutes left to go. Joseph, would you like to unmute and ask your question to the team?
Yeah, thank you so much for the training. I just wanted to find, just to kind of follow up on the topic of recreational therapy, just wondering what kind of activities you would recommend for younger kids, say 3 to 5 year old. And another thing that came up for me though, I was wondering if I could request FMLA for not just medical appointments, but for some of these other therapeutic things like adaptive swim lessons and just general things to nurture the kids, if that's something that's appropriate. And also the third thing was to looking for resources to help kids that are, I don't want to say twice exceptional, but have really like skills, good skills in reading, writing, and things like that, ways that we can nurture their strengths.
Joe, so those are some really great questions. I think given our time, what I may do is have one of our hub team members reach out to you in chat to see if they can answer some of those questions about recreational therapies and some of the questions that you've asked. And we'll go on to just 1 or 2 more questions. Let's see who we've got here. Melissa, did you want to unmute and ask your question?
Yes, thank you. I think for me, the resources, I'm struggling to get the resources and getting contact back from anyone from Children's. I've been through the care coordination, and we've been on the ABA waiting list for several years now. And it's really a lot of the frustration for our family dynamics is because we can't obtain the services.
Melissa, that's a really great question. And I wonder if our presenters from today have any thoughts on that, sort of making your way through some of those obstacles to care, which can be so challenging. I know in the chat, we've talked a little bit with folks about wait lists, but certainly it can be frustrating when you feel like you're calling and not getting anywhere. Do any of our presenters today have thoughts on that?
Hi, this is Sapna. That is so hard and tricky. And I know our system is struggling, in this past year, I feel like wait lists have gotten even longer with the pandemic. And, and what I typically tell my families is like, how do we coordinate that care? Who are providers that can help us get linked with some level of supports while we're waiting for what we're, that end goal of that, full ABA therapy. And we do have care coordination at the Child Development Center. And usually those supports can be accessed more quickly than some of the other intensive therapies. And that could be, it's not that full level of support that the family might be looking for, but it could provide some level of therapies and supports for the family while they're waiting for that higher level need of therapeutic services.
Well, and I've reached out to care coordination and no one really will return my call from that aspect either. So that's further leading to frustration.
I do apologize for that. What we can do is be behind the scenes. Maybe one of us can reach out to you and come up with a plan. We can definitely do that.
Exactly what I would. Thank you so much. That sounds really helpful. Many of you can see, and a few of you are already responding. We have put up our closing poll. I want to acknowledge that we still have a couple of hands raised. In these last few minutes, please feel free to chat those questions into the chat. If our hub team is able to get to those questions and get you information, we'll try our best to do that today. If we're not able to get to your question today, I would encourage you to come back and join us again in the new year. Each of our Echoes gives a new opportunity for sort of questions and support for you all. I think there's a lot we discussed today that I imagine folks still have many questions about. But if you can, go ahead and take a look at the poll on your screen and give us your answers. Again, these are going to be the same 4 questions that you saw in our opening poll. And as we walk through, I'm really pleased to see we still have 100% agreement that folks are really in agreement that it is in fact true that prioritizing self-care is really good role modeling for the rest of the family. So you guys have aced that question number 1. The second question here, when planning for the holidays, there were a couple of options here to think about. And we we may have stumped some people. I think most of our audience seems to agree that C is the answer here. So rewarding positive behavior and adaptability. Some folks have wondered about changing the typical schedule. I think holidays sometimes force us to change the schedule, although maintaining some degree of routine can actually be really helpful. So we would encourage you not to throw out the full schedule, but maintain elements of routine that you can. If you have a bedtime routine, for example, maintaining that even if you're at grandma and grandpa's house for the holidays would be very, very helpful. Our third question, it looks like we have much more agreement here on our third question, thinking about the autism response team at Autism Speaks, who can really help you with all of the above. So A, B, and C, our autism response team is really, really helpful. And many of you have had a chance to chat with them on our call today. And the fourth and final question, as you all are still answering, we're pleased to see that you guys are sort of recognizing the role of psychologists. Unfortunately, as much as we'd love to help you, we are not able to help you with medication management. Go ahead and finish those poll questions if you haven't had a chance. It looks like we have some good responses so far. We really appreciate your participation today and your thoughtful questions.
Hi. I had
Hi.
a question.
Hi,
If-
Mubini. Yeah, if you have a quick question, we can do that. And then we still have some more slides to go. So if
Okay.
you want to ask real quickly and then we can move on, that would be great.
No, just the same question that I had regarding the ABA therapist in speech and OT that I've been trying to reach out to so many places, but it's always a wait time, and especially for the ABA. And I needed some in-home services for my son. So I was wondering, what is the best way that I could go? What is the best route that I could take?
So my first thought for you would be to make sure that you're on a couple of different wait lists. Agencies all have different staffing availability and staff changes. And so it can be really helpful to make sure that you've identified a couple of different good resources and agencies in your area and get yourself on those wait lists. It's also really helpful to continue to be a little bit of the squeaky wheel and call and check in every once in a while. So putting a reminder in your calendar or phone to remind you to call and just sort of check in. The reality is that sometimes helps you sort of move to the top of the list if people have your name fresh in their mind. I don't know if others have thoughts about that as well, because certainly wait lists are a huge struggle for lots of families.
Lisa, I would support that. I think getting on many wait lists, as many as you can, so that you can access services from some point to help you move into the process is a great idea. And being that squeaky wheel, I mean, you make a phone call many, many times. A lot of times, it will help to get into a service you need. I know I have done that in my own life with Henry in trying to access services. So I continue to do that. So we'll put some more things into the chat and then we'll add some more resources as well. But I want to make sure we have enough time for the rest of our presenters. So Andrew, I'm going to move it over to you.
Excellent. So I'm going to really quickly take you through some available resources that we have, as well as share our contact information. I know several folks have been asking in the chat. So autismspeaks.org has many of the next resources I'm going to share with you. And I'm going to take you through at a high level so you can kind of get a feel for all that's out there, but not belabor every single link. So if you start at our website, autismspeaks.org, that's a great place to begin. But again, there's a lot of information there. So I'll show you just a little bit through the next slides. If you're a podcast listener, I really recommend you check out our Autism POV podcast. It's a free download through all the usual channels, but also through our website. There's some great topics on there. One that's really fascinating and wonderful is, what does it mean to be nonverbal? I also encourage you to look at our YouTube page. There's some caregiver skills training videos there. And then you can source our resource guide. So if you're looking in your area for a specific provider, you can actually type in your location and what you're interested in, and it will list all the providers that have submitted a resource with us. We are going to put all of these links into the resource sheet that you'll get at the end of the presentation. So don't feel too discouraged if you're seeing all these links go by and you don't have them. They will come to you after the presentation. Okay, next slide. On this one, I really want to point out we have some great Facebook communities. If Facebook is your thing, we have one for the transition to adulthood. We have one for newly diagnosed families. We have one specifically just for autistic adults. that they can, in a closed group, experience their community. So I want to encourage you to check out some of our Facebook groups. And there's another one out there, and this comes from Ocali, but they're fantastic and they're free. If you're interested in evidence-based support, the Autism Internet modules, that link will be in the resources too. There's some wonderful learning modules you can take through that group. All right, we'll go to the next one. We have an actual guide to IEPs. So if you're somebody who's sitting there thinking, boy, the school IEP process is really challenging, I don't know where to begin. It's a free download. It's a toolkit you can download that guides you through that process and teaches you what questions to ask. We also have a variety of webinars that we've done on the topic of COVID and special ed. So once you're at our YouTube page, you'll see all of those there. You'll get the link to this as well. I'm going to keep rolling. For transition, we all know that that's a big milestone that we need to prepare for. So we have all kinds of resources on our Autism Speaks website. These links will take you to a transition toolkit that you can go through step by step to make plans. We have roadmaps that help guide you in your planning for transition. Another Facebook group there, and I mentioned the Adulting on the Spectrum Facebook group as well. And I think just a few more, and then I'll teach you how to reach out to us when you have questions. Employment, a big growing issue, and we have employment toolkits that'll help take you through all the questions and prep that you need for the employment process. A Facebook group, of course, there for natural in-time, real-time support, and then resources for HR departments, voc rehab folks, centers for independent living, life coaches. We have all of these resources available, and I'll show you how to reach out to those resources in the next slide. The last thing I want to talk about is our COVID-19 resources. So since COVID launched, we've learned a lot, and there are some great things like social stories and other tools that you can use to help with things like mask wearing, vaccine understanding, how to prep for a vaccine visit if you have to go into a clinic, how to prep for that with social stories. Those will all be available to you through the link there, our COVID-19 resources. Now, one more slide. If you are wondering and you're lost and you don't quite know where to start, our autism response team is a great first step. You can call us, email us, chat with us to find local services, ask questions about diagnoses, find tools specific to your need, find resources in your area, know your rights as a parent or a person on the spectrum, and prepare for all those big milestones. So that's what the ART is there to do. We're there to help you all. So I'm going to pass it to my colleague, and then I'll show you how to reach out to us.
Okay. Hi, everyone. So I just wanted to talk a little bit about holiday stress. This is actually a guide from the Marcus Autism Institute. So lots of information about how stressful the holidays can be, especially with disruptions to routines. So any kind of visual supports or pictures or stories, social stories that you can implement will be helpful as you're trying to navigate this season. Go on. So just some tips. Don't throw out your schedule. I know it's different with school being out, but try to stick to the routine as much as possible. So keeping meal times and bedtimes consistent if possible. You might even consider doing some things that follow the class routine. So if you know they eat lunch at this time at school, or if they have, reading time at this time of day, try to follow that along as well. Be mindful about decoration. So let your child know in advance what you're doing. Try to get them involved, go over what is expected of them. And if that's not something that's possible, then try to rearrange the way that you're decorating the house. So next slide. Let your child help you host. So make sure they're involved, come up with a plan for them. Let them know what being a good host is and what some things they could do to welcome visitors and guests. Give them tasks like helping to set the table. This is for older children, obviously. But if you can still, if they're younger, talking to them about it, letting them know, letting them be involved. And then practice giving gifts. So role-playing things like gift etiquette, saying thank you, giving expectations about when we're opening presents and all of that. And then if you go to the next slide, there's some other kind of tips, reminders. So just make sure that you're rewarding positive behavior and that adaptability. Always let them know that they're doing well. Don't have to accept every invitation or attend every event, especially if it's too stressful or distressing, or if you just want to go for a small period of time and you don't stay for meals, or however, whatever works. Make that, and then make any adjustments that you think will be your kind of new family traditions and incorporate new ways of celebrating. I think there's one more. Oh, that's Andrew's.
Okay, so very quickly, there's a couple ways to reach out to us. You can call the 188 Autism 2 number. We also have the Spanish line that you can call in, so our bilingual team can handle that. But if you also just want to remember help@autismspeaks.org, all of those emails come in, and even if you're a Spanish speaker and you want to start there, we have team that are ready to help. But we're open 9 to 5 in all time zones, Monday through Friday. Emails are 24 hours a day that we're trying to respond to, so please reach out. Someone did have a question about international support. While our resources might not be as robust as they are for the US, and there's an ART in Canada we can refer to, we do have some resources available in our database for international questions. So depending on where you're from, we should be able to help or at least get you pointed in the right direction. But we look forward to hearing from you, and please do reach out to us. Thank you.
All right, we're in the final few slides here. So again, you're going to see a link drop in the chat. We'd love to have your feedback. So if you have ideas that you'd like to see for 2022 as far as family echo sessions go, please send that over to us. We'd love to see that. Next slide. Also, like we said, certificates will be coming out to everyone who needs them. It says October Ruby in that slide, but we mean December. So you will get a certificate. Next slide. And session materials. In a couple of days, we'll compile everything from here, from the resources we've talked about, the session link to the video and everything, and that will go out to everyone who's participated today. So look for that in your email, and we're happy to provide that. Next slide. And again, Autism Care Network always has our sessions posted on it. So you can go to through Autism Speaks or through the Autism Care Network, and you can see the sessions that are posted. And again, all of the resources that Andrew talked about are going to be located on those pages as well. And the final slide, we are in planning right now for we're going to do 4 more sessions in 2022, early 2022. We'll do 2 in February and 2 in March. So check back to all of those sites or even our own page here at Nationwide Children's Hospital for when those are going to be posted. We will make, since you've already been a part of this, we'll make sure that you get the announcement. We'll send that out to you, but we're in planning for that now, and we're really excited about what the new year will bring. So thank you everybody for being here. It's been a wonderful 5 series that we've done so far. At some point we will be releasing, if you didn't make it to a series, we will be releasing the information on how to maybe go back and watch a recording if you wanted to see maybe ADHD or anxiety or the Ruby sessions that we did. So we'll make sure we get all that information out. We've got some work to do on it to make sure it's ready to go. But at some point we will release that to everyone. So I hope you all enjoyed today. Thank you to all of our presenters. And our self-advocate Josh was having some tech difficulties, so he didn't make it, but we will see him in early 2022. So have a great night, everybody. Thank you so much.